I'm Maggie Jess, Director of Nursing at AmeriStaff Nursing Services, and welcome to another episode of Boomer Health at Home. On today's show, we will learn everything you need to know about assisted living facilities. Joining us today is Carla Hicks, Nurse and Executive Director at Manoogian Manor. Hello, Carla.
Good morning.
Thank you for joining us today.
Oh, thank you for having me.
So, Carla, tell us a little bit about yourself and how you became the Executive Director at Manoogian Manor.
Well, my background is nursing. It's hard for me to believe, but I've been a nurse now for 25 years. I'm saying that. Seems like I just graduated yesterday, but it's been a while. The majority of my nursing career has been at Beaumont Royal Oak. I started working at Manoogian Manor back in September of 2021 as the Executive Director, and I've been there since. And I love what I do at the Manor, the care of the residents, and I really feel like nursing is what I was meant to do, and my nursing background helps me to take good care of our residents at the Manor.
Okay. So Manoogian Manor is an assisted living facility, is that correct?
Yes.
So what is that by definition?
So assisted living, by definition, is providing personalized care to primarily seniors who come to us, and their care is individualized. We promote their independence. The thing I like about the assisted living facility is that it promotes a sense of purpose for our residents and also promotes their independence. And so what we strive for is having them have quality of life with a variety of activities at the Manor, socialization with other residents at the Manor. It's a nice environment for someone who needs 24/7 care, but yet they still are pretty independent. So we personalize their care at Manoogian Manor.
Oh, wonderful. So they're kind of autonomous in some of their care.
Yes.
Okay. So this kind of leads to my next question. What would then be the difference between, you hear the thing, they say nursing homes, skilled nursing homes, and then assisted living. What's the difference in all three?
The main difference between assisted living and long-term care is long-term care is primarily for seniors or individuals that have more medical needs. And your assisted living facility is where our residents, they need care and supervision, but they're medically stable. Nursing home or skilled nursing, they're more medical needs than we would be able to accommodate at Manoogian Manor. There are times when someone will go to a long-term care facility, say after surgery or after a hospitalization, and then they go for rehab to recover, but then the family will start looking for an assisted living facility to bring their loved one to, because for their personal safety, they want that around-the-clock care for them.
Okay.
Supervision.
All right. So some of the benefits then would be supervision, autonomy. Do you have any others?
Well, a lot of activities. We do promote socialization for our residents, because we want them to still maintain independence, but also have those socialization with other residents.
Okay.
So we do promote that. We want them to feel at home at Manoogian Manor, and we also want them to, frankly speaking, feel loved and cared for. So when they come to Manoogian Manor, we embrace them and consider them part of our family.
Oh, that's wonderful. So then on that end, what type of training do your staff have to take care of those specific needs?
So the training that we have at Manoogian Manor consists of when we onboard new staff, and even our current staff, we have in-services on a monthly basis. We do didactic classes, and we also have dedicated preceptors. The most important thing training allows us to do is for our caregivers to get to know our residents. That's extremely important. What are their likes? What are their dislikes? And what can we do? I always think of the self-care deficit. What is the self-care deficit, and what does that resident need for us to do for them? And so we approach it that way. We also have training for approaches to dementia. We have basic life support training, life fire safety training. So we do a lot of training with our staff because we want them to, one, be well trained in how to care for our residents, but two, we want them to feel empowered if they're in a situation, and if they're not sure what to do, there's always someone else that they can ask a question to, or so that they feel supported in their role as a caregiver.
Okay. It sounds like you cover a broad spectrum of care, but then also individualize it to your patient.
We do. Yes, we do.
That's great. Okay. So do you have staff on site 24/7?
We do. We have staff around the clock, so we are 24/7 care.
Okay.
And monitoring the safety of our residents. We have a dedicated shift supervisor on every shift.
Okay.
There's 2 nurses. There's myself, and then there is a resident care manager who's also a nurse.
Okay. Is there nursing staff at night?
There's not a nurse at night, but there is a shift supervisor on staff.
And then do you have physician oversight? How does that work? Do you have a physician?
We do. We actually have 2 visiting physicians. Now, our residents can have their primary care physician who they have a relationship with. What I like about our visiting physicians at Manoogian Manor is that if I need something, I can call them right away, and I get a response if there's a resident that needs something. So I like the partnership that we have with our physicians in the care of our residents.
Good, that's wonderful. Continuity of care is always key, especially with the elderly.
Oh, yes.
So back to assisted living facilities, I know with home cares, and they talked a lot about nursing homes and regulations these past couple of years with the healthcare environment that's been going on. Are assisted living facilities, regulated?
We are regulated. We are licensed by the state of Michigan, and we have an annual survey, and the state of Michigan will come in unannounced. So they just pop in, and when they come, they're looking at certain things. They want to know they'll look at our care plans for our residents, they'll look at our staffing model, they'll look at our assignment sheets, and I always welcome our surveyor, because what they're going to do is help us to drive that quality of care. And so that's extremely important. So I always embrace when they come in, and they're going to do the survey, but if they see opportunities, it's an opportunity for us to improve. But they do survey us, and they will renew our licensing once a year.
Okay. And that's through the state?
It is through the state of Michigan.
And then accreditations. Are there any specific accreditations that you need for an assisted living, or anything that like you as the director want that you could promote?
Yeah, so our state licensing is our form of an accreditation at assisted living.
Okay.
So different healthcare settings have different regulations and may get different accreditations, which is important. But for Manoogian, our accreditation is our annual survey by the state of Michigan.
Okay. With the state, now I'm going to ask you about insurance. Does insurance cover this at all with assisted living?
Yeah, Manoogian Manor is a private pay, so it is not covered by insurance.
Okay.
However, there are often times when residents are eligible for benefits, and we always encourage our families to apply for those benefits. And some examples of that is through veterans. So we do have several veterans at our facility, and they qualify for veterans benefits, but the family would have to apply to determine eligibility. We also work with the Information Center, which is a Medicaid waiver program, and it does provide sometimes savings to the resident but the family, again, would have to apply for those benefits.
Okay. What about any of your residents that have Medicare? Does that apply too if they have a specific benefit? And what would that benefit be?
So if a resident has Medicare, which the majority do, then that covers some of the physical therapy, occupational therapy that we have on site and some nursing services, but it does not cover the cost of their personalized care at Manoogian Manor.
Okay. You had mentioned earlier about physicians and the good rapport you have to keep up with the continuity of care. Are they allowed to come in and see the patient?
Absolutely, we want them to come and see the resident. So our visiting physicians come in on a regular basis to see our residents, and they have a good relationship with them. They really get to know our residents. It's one of the things that I like about having them on site and visiting. One of our physicians also has a nurse practitioner that will come in on the weekend to see our residents. So it works out really well for us and for our residents who may need something or may need care. And they also fill out forms for our families if they need it.
Oh, that's wonderful. Good. Kind of like a one-stop shop.
Yes.
That's wonderful. When it comes to rehabilitation, let's say one of your residents needed to go to the hospital, came back and was weak. Do you have rehabilitation at Manoogian Manor?
We do have physical therapy and occupational therapy services at Manoogian. We are not a skilled nursing or subacute rehab. So if a resident went to the hospital and needed more aggressive physical therapy, then they would go to a skilled rehab and then return to Manoogian once they return back to their baseline or optimal level of functioning. We would continue their therapy at Manoogian, but sometimes they need that more aggressive physical therapy.
Okay.
Like 5 days a week, sometimes 6 days a week, a couple times a day versus what we would offer at Manoogian.
Okay. So if they needed about 3 times a week, they could come back
Absolutely.
to Manoogian. Okay. And does their physician assess that? Do you kind of take that as well? Is that something that you review upon coming back if they've been at the hospital or anything like that?
Yes, we do. So anytime a resident goes out to the hospital, I will visit them in the hospital, and then prior to discharge, I will collaborate with the discharge planner, go do an assessment to see has this resident returned back to baseline? Are we able to meet their needs when they come back from the hospital?
Okay.
And so it's a discussion that we'll have with the discharge planner.
Okay, wonderful. All right. So now we're on to residents, the best part.
Yes.
Tell us about your residents. What kind of profile of a resident do you look for? Is there something specific you guys have at an assisted living that you're looking for?
So when we do assessments to see if a resident is appropriate for our community, the one thing that is important is that we are able to meet their needs. And so there's no 2 residents that are the same, and that's another thing that I love about our residents and their families. They're just at different stages. One of the things that we look for, though, in bringing a resident to Manoogian is are they mobile? Are they able to transfer by themselves? Are they able to use a walker or some type of assisted device to move about the manor freely? Because we are licensed by the state, there's certain things that we're not able to have. So you will see in your skilled nursing facilities like Hoyer lifts where they need a Hoyer to actually get out of the bed. It's not something that we could have at Manoogian, so we do look at those types of things when we're moving a resident in. Are we able to meet their needs?
Okay, so you also have specific guidelines.
Yes.
Okay. As an assisted facility, is there a room and or bed capacity guideline, or is that just based on the size?
Yeah, well, our facility is licensed by the state for 65 beds.
Okay. Oh, wow. That's a good amount of beds. Okay, great. And then You said you always have nurses on staff during the day, correct? And what is a good kind of staff to resident ratio?
So our staffing model is more team-based.
Okay.
We have a dedicated shift supervisor on every shift. We have caregivers who do medication management. We work very closely with our pharmacy, and we have caregivers on staff around the clock. So it's not primary care, it's more of a team-based model, and generally we'll have 4 team members on the day shift, afternoon shift with a dedicated supervisor, and then we also have a supervisor at night for the night shift. And then myself and Melanie, we're always on call. So if the staff know if they need something, how to reach us.
Okay. So how do you welcome a new resident?
This is interesting because we just welcomed a new resident not that long ago, and I always try to create a lot of enthusiasm when we bring a new resident in, and I took the residents to the lobby with all of our caregivers, and we had balloons and we had some songs, and we try not to be overwhelming. But I do want them to feel very welcomed at Manoogian Manor. We introduce them to our care team. We introduce them to our leadership team. And we always encourage our families to visit initially, because the reality is that when someone comes to an assisted living facility, it's a big decision and a big transition for them. And so what we don't want is them to isolate and feel alone. We really want to engage them in activities for socializing with other residents. But we do roll out the red carpet for them when they come to Manoogian Manor.
Oh, that's wonderful. That's good to know. You feel loved.
That's the most important thing. We want them to feel loved, and we want them to feel cared for.
That's great. So now I'm going to ask about the food. Everybody always asks about the food. Everywhere and anywhere. At a hospital, you'll hear someone say, well, the food was really good, or oh, I hated the food, get me out of here. So what type of meal plans do you offer? Do you allow your residents to eat in their rooms, or can they go to the cafeteria? Do you have a cafeteria? What do you call it? Am I talking out of turn?
Yeah, no, we do have a dining room.
Okay.
And I encourage the residents to eat in the dining room. Again, it goes back to those socialization skills for them, because we don't want them to isolate in their room. So our cooks are phenomenal. They make a lot of different dishes. We have Armenian dishes, Italian dishes, we have American dishes, so there's a wide variety of food. If there's a resident that doesn't like what's on the menu, we always have alternatives for them. So we have homemade soups, of course the deli sandwiches. So we try to make sure that we're giving the resident food that they actually like. And I can't say that our residents complain about the food. It's, they enjoy the food at Manoogian. And we have to be sensitive to those who have special diets, and so we have residents that are on mechanical soft, or maybe they're on a pureed diet, and we do accommodate those diets. As far as a resident eating in their room, again, we try to encourage them to come to the dining room. If someone was adamant that they wanted to eat in their room, I would certainly allow them to do that.
Okay.
I wouldn't want it, I wouldn't promote it or encourage it for every day, but every once in a while it's like I just want to stay in my pajamas, and this is their home. Right? This is their home. So if I wanted to eat breakfast in bed, then I want them to eat breakfast in bed. We just take the food to them.
Yeah. I've noticed when I started conversing with you and doing this interview, I was calling them patients because that's what I'm used to. They're not, they're residents.
So it took me a long time, Maggie, to figure that out. So because of my nursing background, for a long time I called them patients. So I did the exact same thing.
Yeah. Well, you get used to it, I guess,
Yes.
right?
I think the difference too is in the hospital setting, our patients, we see them during their hospital stay and then they leave and they go home. With our residents, like this is their home. So we really get to nurture the relationships that we have with our residents and our families because we see them every day.
Yeah, you're with them.
All
That's
the time.
wonderful. That's great. So you had mentioned too, to get that socialization, you guys do a lot of activities. What are some of the activities that Manuka Manor offers?
There's a wide variety of activities. We have a life enrichment director who plans the activities for our residents. And we have activities at the manor, and we also have off-site activities. Last year, we went to a Tiger game, took them to a Tiger game. A lot of our families joined us. We went to a couple outings to Big Boys Restaurant. We go to concerts in the park. We do, there's a library that also has music and concerts in the library. It's just meaningful for the residents, and I don't know what it is about the dollar store, but our residents love going out to the dollar store. It's one of their favorites, and so our life enrichment director will take a couple of trips to the dollar store. The other thing that we did last year was we had a car show. We have some of our veterans, and then we have residents that have worked at Chrysler's or Ford's or GM. And so having that car show and having them go out to see the old cars, they just light up, and it's just refreshing when you see it. And then their families are invited to come out. It was one of the, in my humble opinion, one of the best events last year. Just seeing the interaction with the residents and the car owners and their families. And we, of course, have like a big picnic for them.
Oh, that's so
Yeah.
wonderful.
Yeah, they really enjoyed it. Some of the residents still talk about it and wondering if we're going to have it this year.
Oh, yeah. So I assume you're going to have it.
Of course.
Oh, that's great. Oh, that's so cool. So when you change up activities, is that by some intake or communication from the residents? Do they kind of play a role in any of the change up that you guys have, like in menus or activities or anything that kind of goes on at Manugan?
Yes, absolutely. We do have a resident council meeting once a month, and this is an opportunity for our residents to really share their thoughts and ideals on maybe they like something and they want that more often, or maybe they don't like something. The reason we have a wide variety of activities is for residents who suffer from dementia, we're not able to cure that. However, we can prevent further decline by engaging them in meaningful activities. And so some of our activities are geared towards those who suffer from dementia, but not everybody wants to participate in those types of activities. And so at the resident council meeting, it gives our residents the opportunity for us to hear their voice. What do you like? What do you not like? What would you like to have come? If there was an activity that would make you happy, tell us what that is. And then the life enrichment director will look at those activities and bring them to the manor. And then I have tea with the residents once a month. I call it my sacred time with them. It's one of my most favorite things that I do at Manugan, because I have the opportunity to just be present with them and listen to if they have any concerns, or if it's just chit chat. And I love hearing about their history. A lot of times they'll tell me where they grew up, where they went to school. And it's just really a nice time to really just be present with their residents.
Yeah, and you get to know them on a different level.
You do, yes.
That's wonderful. Do you also have, kind of like you were saying, the resident council, family involvement, or is the family allowed to come to those? Do you have different meetings for family? How involved can they be?
the families don't typically come to the council meeting or to the teas, but we communicate with our families, and families will come into the manor, and they will, if there is a concern, they'll share it with us, me or the resident care manager. And if there's a concern, we take it seriously and we follow up appropriately and timely. But our families are what I consider our partners in care. So we look to them, especially if a new resident is moving in. They provide substantial advisory support to us on the care of their loved one. So those relationships with our family is extremely important.
Wow, that's wonderful.
Yeah,
it's
and
good to know.
Yeah, thank you. And we want our families to be involved.
Yeah. So, Carla, tell me what sets Manoogian Manor apart from the array of other facilities that are in the southeastern Michigan area.
Well, the number one thing that sets Manoogian Manor apart is that we are not corporate care. So Manoogian is, it's a smaller facility. We do provide individualized care to our residents. Our culture of caring, our culture of safety, our culture and relationships with our families and our residents is really what sets us aside. We are not a corporate care enterprise.
Wonderful. Okay, great. So if our residents have any questions or concerns or just want to call, where can they reach you?
The residents?
Yes,
Yes.
or family members, excuse me.
So all of the family members have my cell phone number, and they know where my office is quite often. Like I'll get a resident that will come down and, they'll ask me about something, and I'm always in the community. So residents always see me out in the community, in the dining room, in the, just out in the community at Manoogian Manor. But all of the families have my cell phone number if they needed to reach me for anything.
Perfect. That's wonderful.
Thank you.
Okay, great.
Thank
And then
you.
for anybody watching the show, where can they get any information about Manoogian Manor?
So we do have a website. So you can look up Assisted Living Manoogian Manor in Livonia. They can also call the manor. The phone number to the manor is 734-522-5780. And they can come in and do a tour of our facility. I'm happy to show families around and take them on a tour.
Wonderful. Thank you so much for joining us today,
Oh,
Carla.
thank
This
you
has
for
been wonderful.
I got to talk about Manoogian Manor. Thank you for having me. Thank you.
That was great.
Thank you.
Thank you for joining us today on Boomer Health at Home. I'm Maggie Jess, Director of Nursing for AmeriStaff Nursing Services. And if you'd like more information on today's show, please call us at 248-288-2270. And as always, stay safe and healthy.